triple negative breast cancer is one of the most challenging breast cancers that we have, because although we really do cure about 75 to perhaps even 80% of women with standard chemotherapy, the other 20% we simply do not have the tools for at this moment. And we don't have any specific targeted therapies because what is actually driving that resistant triple negative breast cancer is not well understood at this time. So for metastatic triple negative breast cancer, the lifespan is very short. It's in the 12 to 18 month range. And it's because it's very genomically unstable, and we don't have a clear way to kill off that profuse heterogeneity that we have within the tumor cells. Metastatic triple negative breast cancer occurs in about 20 to 25% of women who are originally diagnosed with triple negative breast cancer, in spite of our best therapies, which are chemotherapy at this point. And the problem with metastatic triple negative is that heretofore we've not had a specific target to go after, and the cancer's very genetically unstable. So there's all different sorts of subclones and a great deal of heterogeneity. And so any one treatment doesn't work very well against it. And unfortunately, the median survival is in the 12 to 18 month range. And so we have a lot of unmet medical need there. Of course, the most important unmet need is to prevent the metastatic breast cancer in the first place, of course. But the discoveries are made in the metastatic setting and then are moved up into the curative setting. There's a tremendous amount of research and a growing understanding of some important targets in triple negative breast cancer. These are usually evaluated in the metastatic setting first. The immunotherapies are the leading contenders. They're the furthest along, and the challenge is to find the correct subset of patients who may benefit. But other important targets are the AKT pathway, for example. This is a key driver in triple negative breast cancer, and we've seen some early proof of concept trials in the triple negative setting. And in fact, in metastatic disease, there is a phase 3 trial going on now with ipatasertib in metastatic triple negative breast cancer. We know that the androgen receptor is important in triple negative breast cancer, a subset of them, but it is still very much of a work in progress to find out which patients may benefit from an androgen receptor inhibitor alone or in combination. And then there are new antibody drug conjugates in metastatic triple negative breast cancer. Sacituzumab is pending before the FDA right now with regard to an accelerated approval because the preliminary data look very good in metastatic triple negative breast cancer. There's a number of new agents coming, thankfully, and no doubt we will soon be able to break triple negative breast cancer down into subtypes that can be specifically targeted.